All right, so in this collection of videos, I'm actually going to do five separate videos for each of the determinants of health. Okay, so they should be shorter, touch wood, and each of them will cover a different determinant, and therefore you can just flick to the one that you are struggling with the most and learn from there. So for each determinant, I'm going to go through it in a very systematic approach, like sort of using the alarm matrix. You know, what is it? What does it do? How does it do it? What does it lead to? And give you some examples, a positive one and a negative one. So for each determinant, the main heading is going to be here, central to the screen, and then the actual factors that fall under the determinant, I will list up here, all right? So let's go. Our first determinant of health is our broad features of society, okay? And the first factor that we look at there is social interaction, okay? So social between people, etc. So what is it? It's the way people connect with family and friends, community, to support each other. They talk about their ideas of health, okay? What is healthy, what isn't healthy, all right? What does it do? It shapes the habits and attitudes about health by influencing what we perceive as normal, you know? For example, if you are raised in a family that just eats lots of takeaway food, then you grow up thinking that eating lots of takeaway food is the way you feed your family. And then you probably feed your family with lots of takeaway food and the cycle goes on. How does it do it? So peer pressure and family role modeling that encourage or discourage certain behaviors. So it's not always going to be negative, it's going to be positive, all right? So if you look at that same thing again, if you grow up in a family where your mum and your dad go to the gym regularly and they play weekend sports, you're probably more likely to, when you're at the appropriate age, go to the gym and then play weekend sports. What does it lead to? Greater support in healthy habits, because if you've got good social networks from your family and your peers, then you're more likely to be encouraged to do the healthy things, or they might be the other way and they encourage you to participate in risk-taking behaviors, all right? So peer pressuring you into doing things that aren't necessarily very healthy for you. So for example, peers who exercise together and they encourage each other, and therefore they continue to be consistent with their exercise. They keep showing up, all right? And you keep showing up, that's half the battle. Or alternatively, if you grow up in a family that smokes and vapes, or if you have friends that smoke and vape, they're more likely to encourage you to do so as well. I'm not saying your family's going to encourage you to smoke and vape, but because you see them doing it, you just think that's normal, so you smoke and vape too. So that's social interaction. Okay, so our next part of broad features of society is culture, all right? Culture is the shared beliefs and customs passed down through families, religions, and ethnic groups. Culture can influence diet, how you view illness, and what health practices you may follow, all right? So for example, there are certain people who are Christian who believe that if you get sick, it's part of God's plan, and they won't do anything about it because God will make them better. Or there are certain more Eastern type medicines that if you are sick, then you won't go and see a doctor, you'll probably go and see like an acupuncturist or like Chinese herbal medicine instead, whereas there might be actually a pill you can get from the chemist to fix you. How does it do it? So it teaches and enforces values and traditions that are part of their culture. So diet, dress codes, certain remedies, etc. What can it lead to? Well, culture can either protect your health from preventing certain activities being part of what you do in daily life, but it can also create barriers to getting better. As an example, certain cultures have communal dance traditions, and that encourages physical activity, especially amongst young kids. But as another alternative example, there are cultural rules against certain attire and dress codes, especially for females, and that can limit their sports participation and therefore reduce their physical health. So that's culture. All right, so our third broad feature of society is media, all right? What is it? TV, radio, social media, etc. Okay? It all spreads information to large audiences. Media can shape public opinion by highlighting certain messages and images, and most of the time those are actually paid for by companies, right? And that's why they get pushed to the top of your feeds, because there's someone with an ulterior motive in the back end feeding social media. thousands of dollars. How does it do it? So it does it through news reports, advertisements, influencers, celebrity endorsements, etc., etc. So media can drive positive change, such as encouraging vaccination, social distancing, so think of like the things we did in COVID, but it can also encourage harmful practices, such as like, fad diets, or like the ice bucket challenge, which people were doing for ALS a few years ago, and then a couple of people died because, dropping a whole bunch of ice onto your head is not really a great idea. Examples. We have a social media campaign on proper hand washing protocols. All right, I'm sure you've all seen one of them. And negative examples, advertisements for processed foods, encouraging their consumption. Like you watch an ad for KFC and all of a sudden you just, shut up and take my money sort of thing. So that's media. So our fourth and final one for broad features of society is government. Okay, what is it? The government, the federal government, state government, and local governments all work together to create and enforce policies and laws to ideally keep us healthy. So they fund and regulate health services, environmental controls, waste management, etc. All right, and other policies. So policies such as, no smoking areas, okay, for example. Policies such, hospital funding is included in that. Medicare, all right, so the whole funding of Medicare so that you can go and see your GP no gap as long as they bulk bill. Public health campaigns, so think about the current campaigns you see on TV, etc., and social media. So good policies reduce health inequities. So if we notice that, for example, there's an outbreak in COVID-19, for example. Good policies that were put in place there sort of stopped the rising numbers and brought them back down, So you think of all the things we did in COVID, social distancing, wearing masks, lockdown, working from home, all that kind of stuff. Whereas bad use of resources and bad policy creation can actually make the gaps worse. So imagine if we go back to the COVID time and you think the government actually said, well, which is a lot of people's headspace at the time, we're like, well, everyone's going to get it, so we might as well just let everyone get it. All right. So imagine if we didn't go into lockdown and we didn't do work from home, we didn't wear masks, and we didn't social distance. Okay. Everyone, like the numbers would have kept rising and rising and rising, and we probably would have had a higher degree of mortality from it as well. Examples. So we've got increased taxes on cigarettes, which kicked in about 15 years ago now, drastically increased the cost of a pack of cigarettes for the consumer. And therefore, that was a huge determinant in people actually smoking, all right? So I used to, way back in the day, work at Kmart, and part of my role on the service desk was selling cigarettes. And a packet of cigarettes averaged between about $8.50, and I think the most expensive at the time were like the Horizon 50 packs, and they were about $17, okay? And nowadays, I think, I don't know how much a pack of cigarettes is these days. I think they're like upwards of around $50. I could be wrong. Negative example, budget cuts to like rural clinics, okay, could increase barriers to medical care for people that live in rural and remote areas, and therefore decrease health outcomes in remote towns, which would be bad. So they were our 4 factors that are included under the broad features of society determinant. Thanks.